This video serves as my standardized patient reflection video. I had the patient with a possible hip injury, and Kelsey was my second investigator. I felt very comfortable during this encounter. I don't think that there was a point in time where I didn't feel like I could come to a conclusion. I really like the way that these standardized patient encounters are set up compared to SPs prior. It was nice to have somebody to bounce other ideas off of, especially like a student and a professor. And I liked being able to like time in and time out. So like after each section that I would evaluate this person, I was able to like step back and be like, okay, these are my differentials. These are what I'm thinking. This is why I'm thinking it. And then with each section that we went further into the evaluation, I was able to say, okay, yeah, I still am on track with that differential, or wow, okay, no, this one is not like really relevant anymore. And it was nice to have somebody else there with me because, I mean, you can come to the same conclusion at the end, but everybody's going to get to it a little differently. So it was nice to have somebody else to like bounce ideas off of, and if I missed something, like she was able to contribute, or vice versa. Like there was things that she was asking and then it made me think of other questions. So it was nice to have that. And then it was nice to have our professor as well, like prompting us, because we may or may not have been on the right track. So the questions that we were prompted with helped us to either ask further questions or kind of rule in or rule out what we were thinking. So I really liked the way it was set up and I felt pretty comfortable. What went well? I think basically the flow. Like I started with a lot of history questions, and I think that I asked a lot, but I think it was enough to get me to like a starting point with my differentials. From the beginning, I kind of had like an idea of what he could be presenting with, but obviously like going through the evaluation gave me a better understanding of what I was actually looking at. So I think it went well, like to start and get all the questions in that I needed, and then like obviously bouncing stuff off of Kelsey and like asking her like what she thought, why she thought that way. Like I feel like we were able to work well together. So it was like not just like me with the ideas, it was her with the ideas, and we were able to like both come to the conclusion together. I don't feel like one of us like overshadowed the other. And I mean, seeing as I was a lead investigator, she was kind of like, she helped guide me to where I needed to be, but she didn't like step on my toes. So I felt like that went well. I felt like the patient was actually pretty forthcoming with the information, so that was nice to have some like feedback and be able to really formulate like my differentials. It's really hard sometimes when patients aren't as forthcoming and you have to really like pull and pry information out of them. So I felt like that went well, getting the patient to speak like and give me a lot of history. I think my communication was decent between the patient and then with Kelsey as well. Like I think I was able to get my point across and be able to ask questions that the patient was able to understand, and that's how I was able to get like good information from the patient. I made sure to introduce myself, which is a really big deal, especially if it's a patient that we don't know. I mean, we obviously knew each other because we're classmates, and if we're at clinicals, we mostly know our athletes, but I sometimes forget to introduce myself, especially like when it's an emergency situation, but I felt like introduce myself was a really big deal, and so I made sure to do that in the beginning. And then what didn't go so well, I feel like I started to second guess myself, and I had an idea from the beginning, which kind of ended up being my very end diagnosis, but throughout the evaluation, I started like doubting my direction and like where I was going, and so I felt like I kind of like lost my groove kind of halfway through it, and that's like something that I definitely struggle with, is like keeping the confidence in myself, and like I know what I'm doing, and I know that I have enough education to come to some sort of conclusion, but I have a hard time sometimes trusting myself. So I think that I need, like, that needs to improve, like, just going with my gut and following through, and even if I'm wrong, being able to like come to a conclusion, decide why I came to that conclusion, and be able to formulate a plan, especially if it's a standardized patient, because obviously, one, this is not a real injury, and two, even if it were, I have people around me that would give me a second opinion, and obviously I wouldn't be hurting an athlete. So I think that was something that didn't go so well. And then something else that I wouldn't say didn't go well, but it was what took us longer to come to our conclusion, was I assumed that when the patient said that they had been doing rehab, it was prescribed by an athletic trainer. And so I didn't ask if they had seen a physician or whom they had seen. So with my assumption, it was incorrect. And so if I were to have asked the patient who they saw, I would have known it was a physician, and I would have known that there were x-rays, and that the physician told the athlete that there was a bony like growth on their femur. So I would have known that information if I were to have just asked more, or like tacked on to the question or information that he had given me. So I don't want to necessarily say that was like bad, but it was an error on my part, because I feel like if we would have known that earlier in the evaluation, we would have been able to narrow down a lot sooner than getting to the very, very end and that information all of a sudden being given to us. So I think that was something else. Is like, I did ask a lot of questions, but that was something that I missed, and it would have helped us in the beginning. I don't think anything else really went poorly. I think it's just another thing of just getting back into the groove. I mean, I did work over the summer with athletes, but it was like it was a very different setting, and so it wasn't so much like chronic injuries and asking history. It was a very acute issues, or very just like tendonitis, like things that could be handled with like taping or icing, or we were sending them to the emergency room. So I feel like my total evaluation skills are a little rusty maybe, and so just getting back into the swing of things and like getting back into like the full evaluation will definitely like improve my skills. And then this will impact me overall, because this is a learning opportunity and it's in a safe environment. So I had a professor with me, I had another student with me, and it wasn't like a real athlete. So we were able to like sit there and problem solve and like not like pigeonhole myself from the very beginning. Like I was able to, you know, have a differential and then go back and forth and like figure it out at the end. Like it came together at the end. So I think that these learning opportunities will always help me in the future with other evaluations, because it gives me an opportunity to see like, okay, this is where I went wrong this time, I won't go wrong there again. And so it just helps me to get more and more practice, and helps me to become more and more comfortable with the total evaluation, and then delivering what our course of treatment is going to be. So I think that this is going to help, like especially the way it was set up this time. Like normally with our SPs, we go in by ourselves, and I've always felt comfortable doing that, but I think it was really nice to have this opportunity to have another student and then also a professor. So I wouldn't say that like one is better than the other, but I did really like having somebody else to like bounce ideas off of, and being able to say, okay, time out, like this is what I'm thinking, is this kind of where you are too? So I think just like having that person to help me, but also like learning how to work with other athletic trainers and like the type of communication that needs to happen, that's like something that's really important, not only like throughout school, but also like when you get out into the real world and you're dealing with multiple athletic trainers, you have multiple athletes. So it's like you really need to be able to communicate with the athlete and the other ATs around you to be able to come to a good conclusion for the athlete, because ultimately that's what our job is, to take care of the athlete. So I think overall SPs are a really great opportunity for us to get in practice and become more comfortable with our skills, because we know what we're doing. We just don't have the full vote of confidence in ourselves. So I really liked this SP, and I feel like it can only go up from here.